You can tell a lot about someone's face by noticing the small differences between the left and right side. Facial asymmetry quietly reveals habits, muscle patterns, and how their expressions naturally form. One eye height asymmetry. One eye slightly higher or lower. You've seen this in photos. One eye appears slightly higher than the other. This subtle asymmetry often says more about your natural anatomy than you realize. Eye height differences can influence how expressive, alert, or tired someone appears, which shapes first impressions in social interactions. Eye height asymmetry simply means the bony structure or soft tissue around one eye sits a bit higher or lower. This is extremely common and usually part of natural facial development. It can also form from sleeping habits, muscle tension, or slight differences in bone growth. The difference happens because no human face develops perfectly evenly. Genetics, muscular strength, posture, and even habitual expressions contribute over time. This asymmetry might reveal which side of your face is more dominant or more expressive. Sometimes the lower eye appears when tiredness or muscle fatigue sets in, but it doesn't signal anything about personality. In photos, one eye may look more open. In tense conversations, one side of the face might lift more, making the eye appear higher. You can check yourself. Have you noticed one eye appearing more open when you're relaxed? Do photos from certain angles highlight the difference more? Improving posture and relaxing facial muscles can reduce how noticeable this asymmetry looks in different situations. 2. Eyebrow shape, height difference. Uneven brows. If one eyebrow naturally sits higher, you might already know how much it changes your overall expression. Eyebrows frame emotion. A height difference can subtly shift how others read your interest, mood, or engagement. Uneven eyebrows occur when one side's muscles are more active or when the bone structure varies slightly. Some people raise one brow more often, creating a long-term muscular habit. This difference appears because certain muscles, especially the frontalis, become stronger on one side due to expressions, chewing habits, or even vision dominance. It might reveal your more expressive side. The higher brow may suggest attentiveness or curiosity simply because the muscle is more active, not because you feel those emotions constantly. In conversations, the higher brow may lift even more when reacting. During photos, one brow may appear naturally raised. You can check yourself. Do you raise one eyebrow more when surprised or skeptical? Does one arch look sharper in photos? Becoming aware of habitual expressions helps balance your facial movements and reduce unintended emotional cues. 3. Cheek volume asymmetry. One cheek fuller or flatter. A fuller cheek on one side is extremely common, and it can subtly change how warm, youthful, or defined your face appears. Cheek symmetry affects perceived emotion. Fuller cheeks can soften expressions, while flatter areas may appear more serious. Cheek asymmetry comes from natural fat distribution, bone structure differences, chewing habits, and sleeping positions. Most people favor one side while chewing or sleeping, affecting long-term muscle use and tissue compression. It happens because facial muscles develop unevenly based on usage. Genetics also plays a role, creating slight volume differences from childhood. This might reveal which side is more active when you smile or chew. It can also show which side you sleep on, but it doesn't reveal personality traits. In photos, one cheek may appear rounder. During a smile, one side may lift higher or look fuller. You can check yourself. Do you chew more on one side? Does one cheek look fuller when you smile naturally? Switching chewing sides and improving posture helps maintain balanced muscle activation over time. 4. Mouth corner asymmetry. One corner higher or lower. A slight tilt in the corners of the mouth can change your resting expression more than you think. Others often interpret mouth asymmetry as a sign of mood, even when you're neutral, so understanding it can help you manage unintended signals. Mouth corner asymmetry shows when one side naturally sits higher due to muscle strength, nerve pathways, or habitual facial expressions. The zygomatic muscles often differ in tone from side to side. It happens because one side of your face becomes more engaged when you talk, smile, or react. Over time, these habits strengthen one side more. This might reveal the side you smile with first, or the side that activates under emotional load. However, it doesn't mean anything deep about your personality. it's muscle preference. In neutral expression, one corner may appear slightly lifted. In photos, your smile might appear stronger on one side. You can check yourself. Does your smile start on one side first? Does stress make one corner pull down more? Gentle facial relaxation exercises help reduce tension that exaggerates asymmetry. 5. Jawline asymmetry, one side sharper or more rounded. A jawline that looks sharper on one side is usually not genetics alone. It's a map of muscle use and daily habits. Jaw asymmetry affects how strong, relaxed, or tense your face appears. People may interpret it as confidence or stress, depending on how pronounced it looks. Jaw differences come from chewing patterns, bone shape, muscle tension, and posture. The masseter muscle on one side often becomes stronger due to chewing dominance. It happens because most people chew primarily on one side, tightening and enlarging that muscle over time. Sleeping positions and dental alignment also contribute. This might reveal which side you use more for chewing or where your facial tension gathers, but it doesn't indicate deeper traits, just long-term habits. In mirror selfies, one jawline may look sharper. Under stress, muscle clenching may make one side appear more pronounced. You can check yourself. Do you chew gum or food mostly on one side? Do you clench your jaw under stress? Alternate chewing sides and practice jaw relaxation to reduce uneven tension. 6. Nostril size shape difference. Uneven nasal structure. If one nostril looks slightly larger or shaped differently, you're seeing one of the most common forms of facial asymmetry. Nasal asymmetry can subtly affect the balance of your facial expressions and even influence how your voice or breathing sounds in social settings. Nostril differences usually come from natural variations in cartilage, slight deviations in the septum, or differences in soft tissue thickness. It's part of normal facial development and rarely indicates anything deeper. These differences happen because the nasal cartilage doesn't grow symmetrically, or because airflow habits, allergies, or mild septal deviations shape the tissue slightly over time. This might reveal which side you breathe from more easily, or which side responds more strongly to swelling or irritation. It doesn't reveal personality, just physical tendencies. In selfies, one nostril may appear wider. During deep breathing or emotional moments, airflow differences may make expressions look slightly uneven. You can check yourself. Do you notice you breathe more easily through one side? Does one side flare more when you laugh or react? Cleaning nasal passages and practicing balanced breathing can help reduce exaggerated differences in airflow and appearance. 7. Smile asymmetry. One side lifting, more during smiling. Your smile doesn't always rise evenly, and that small imbalance reveals how your facial muscles really work. People read emotions through smiles. Even a slight asymmetry can change how warm, genuine, or reserved you appear in social moments. Smile asymmetry happens when the muscles on one side, especially the zygomaticus major, activate faster or stronger than the other side. Sometimes nerve pathways are more responsive on one half of the face. It develops from expression habits, speech patterns, or simply because one side of the face is naturally more expressive. Fatigue or emotional intensity can make this more noticeable. This might reveal which side of your face leads emotional expression. It often shows which side is more reactive or dominant, not how authentic the smile is. When you laugh, one side may lift first. Photos may capture one corner rising higher or showing deeper lines. You can check yourself. Have you noticed your smile pulling to one side? Does your photo smile lean differently from your natural smile? Relax your face before photos or social interactions. A softened starting point balances both sides naturally. 8. Eyelid asymmetry. One lid, heavier or more open. One eyelid sitting lower or heavier can change your perceived mood, even when you're perfectly relaxed. People often interpret eyelid asymmetry as tiredness, seriousness, or alertness, depending on which side appears heavier. Eyelid asymmetry happens when the levator muscles differ in strength or when the skin on one side has more natural laxity. Genetics, eye dominance, and aging patterns all contribute. It develops because dominant eyes stay more active during reading, focusing, and reacting, creating slight differences over time. Sleep habits and sinus pressure can temporarily exaggerate the asymmetry. This might reveal your dominant eye or which side reacts more intensely to fatigue. It doesn't reflect personality, just muscle activity and anatomical variation. On long days, one eyelid may droop more. In emotional conversations, the more expressive eye may widen while the other remains relaxed. You can check yourself. Does one eye feel heavier at night? Does your wider eye show up more in photos? Resting your eyes and adjusting screen habits reduces fatigue-driven asymmetry. 9. Chin deviation. Chin slightly shifting to one side. A chin that tilts subtly to one side isn't a flaw. It's a story of muscle patterns, posture, and development. Chin deviation can influence symmetry in photos, facial balance, and how your expressions are interpreted in conversations. Chin deviation occurs when the jawbone grows slightly angled, or when one side of the jaw muscles exerts more pull than the other. Dental alignment and posture also influence direction over time. It forms because people often chew predominantly on one side, sleep facing the same direction, or hold habitual posture that shifts muscle tension unevenly. This might reveal long-term chewing habits, posture tendencies, or mild muscular imbalance. It doesn't reveal character or emotional traits. In selfies, your chin may point slightly left or right. During stress, clenching can exaggerate the deviation. You can check yourself. Do you notice your chin tilts when you talk? Do photos highlight the angle more sharply? Relaxing your jaw and balancing chewing habits can help prevent further asymmetry. 10. Facial muscle dominance. One side, more expressive or active. If one side of your face seems livelier when you react, that's a sign of natural muscle dominance. People often interpret expression strength as emotional intensity. Understanding dominance helps you recognize what you're actually showing. Facial muscle dominance occurs when one side of your face fires faster or harder due to neural pathways, habitual expressions, or lifestyle patterns, like chewing or sleeping positions. Over time, these habits strengthen one side and create a clearer difference in how expressions appear. Smiles, frowns, surprise, or tension. This might reveal which side leads emotionally charged expressions. It often signals preferred muscle pathways, not personality traits. During conversations, one eyebrow may rise first or one cheek may lift higher. In emotional reactions, one side may activate noticeably quicker. You can check yourself. When you smile, does the expression start on one side? Does one half of your face feel more alive when reacting? Mindful relaxation before speaking or reacting can help create more balanced expressions. Facial asymmetry isn't a flaw. It's a map of your natural habits, expressions, and muscle patterns. If you want more clear, science-based breakdowns like this, consider subscribing for future videos.